COVID vaccine mandates have sparked plenty of political debates. But for some people, a mandate can mean the difference between keeping or losing your job. And we're joined now by one such person. Until recently, Kendall Klett worked for the North Carolina Department of Health and Human Services, and Carolina Journal recently documented her story. Thanks for talking to us.
Thanks for having me, Mitch.
We're going to start this conversation by turning the clock back to October of 2020, and I understand at that time you actually had a case of COVID. What can you tell us about it?
Yes. My husband and I both came down with COVID October of 2020. We both had very mild cases. And this was pre-vaccines and really pre any kind of treatment. So we didn't get tested at that time. We stayed home and self-quarantined until we felt better. Subsequently, I did confirm that I had COVID. I had 3 different antibody tests, which did confirm I had it.
I'm not sure if before you had COVID-19 this was true, but certainly afterward you became very interested in how it affects you and the natural immunity issues. What did you start doing after you'd had that case?
Absolutely. So, of course, the vaccinations were in the news constantly once they came online, so to speak. And right away, I guess, there was a discussion on whether those who had previously had COVID would need vaccines. And the more I read about it, it seemed all the evidence was pointing in that direction. So about August of 2020, the department announced they were going to be doing the vaccine requirement, or...
This is August of 2021?
Oh, August 2021. The department announced that they were going to be doing either, a requirement for vaccine or weekly testing. And at that time also, the Israeli study came out, which was one of the first very big natural immunity studies. This study involved hundreds of thousands of people, and it determined that vaccinated people were 13 times more likely to contract COVID than those who had previously had an infection, 27 times more likely to have a symptomatic infection, and 8 times more likely to be hospitalized, which seemed incredibly compelling to me. So I approached our administration and I asked them how natural immunity was going to play into their enforcement of the mandate.
And as I mentioned, Carolina Journal has documented your story. There's an article with the headline, DHHS employee fired over vaccine mandate despite natural immunity. And in this story, it documents that you had several back and forth exchanges with people at the department. Tell us a little bit about how that went.
It was kind of shocking because I really did anticipate they would have a lot more science to back up their claims, and I thought that they would try to argue with me about the validity of and the strength of my natural immunity. They really did not. I had some online interviews with them, and it seemed as if they didn't even want to say the words natural immunity.
And these are the folks who, this is what they do, health, and you think they would, of any state government department in North Carolina, you would think DHHS would probably be the most interested in the health and the science issues.
Exactly. And then the information came out in late September, I believe. They released their own information that had previously not been released about the reinfection rate in North Carolina. Unbelievable. It was lower than 1% since the epidemic began. And then I responded with a somewhat outraged letter to the administrators saying, you knew this the whole time. Why are you fighting me on this? Why are you not making an exception for those with natural immunity? And again, there was really no answer. The one person who did try to respond to me with a little bit of science was Dr. Susan Casangra. She's the acting senior director of DHHS. And if I may, can I read her?
Certainly.
Okay. So she sent to me a statement that said, vaccination provides a higher, more robust, and more consistent level of immunity to protect people from COVID than infection. People who have already had COVID and recovered should get vaccinated. Along with this statement She gave me a link to the latest CDC science brief that was released in early October, and this was to support her claim. So I read the footnoted studies. I did not see anything in it that supported her claim, but there were many studies that supported natural immunity in there, at least 10, and one of them was a summary of a variety of natural immunity studies, and I will read that as well. So this is a review of available literature on PubMed, MedRx, and FDA briefings to identify clinical studies either comparing COVID vaccination to natural immunity or delineating the benefit of vaccination in recovered individuals. Quote, 9 clinical studies were identified, including 3 randomized control studies, 4 retrospective observational cohorts, 1 prospective observational cohort, and a case control study. Findings. All of the included studies found at least statistical equivalence between protection of full vaccination and natural immunity. And 3 studies found superiority of natural immunity. 4 observational studies found a statistically significant incremental benefit to vaccination in the COVID-recovered individuals. Vaccination in COVID-recovered individuals provided modest protection from reinfection, but the absolute risk difference was extremely small. While vaccinations are highly effective at protecting against infection and severe COVID-19 disease, our review demonstrates that natural immunity in COVID-recovered individuals is at least equivalent to the protection afforded by full vaccination of COVID-naive populations. There is a modest and incremental relative benefit to vaccination in COVID-recovered individuals. However, the net benefit is marginal on an absolute basis. COVID-recovered individuals represent a distinctly different benefit-risk calculus. Therefore, vaccination of COVID-recovered individuals should be subject to clinical equipoise and individual preference. End of quote.
Sounds as if the information that was sent to you to justify the vaccine mandate instead justified or at least supported your position.
It was as if she had not read that study. It was almost as if she just assumed it supported her point.
So eventually this comes to a head. We've already said from the headline, you lost your job because of this.
Right.
How'd that happen?
Well, as I said previously, they really didn't want to argue my viewpoint on natural immunity or the validity of my argument. They just became locked into the fact that this was their policy, and they wanted me to comply, and I would get weekly notifications that I hadn't submitted proof of my vaccination or proof of my weekly testing. And then it started going through the disciplinary process, which consisted of them warning me 1 week. I still didn't comply. The second week, they gave me a 5-day suspension, and then I didn't comply. And it was by about a couple weeks later, actually last Friday, they finally issued my final termination of my employment.
You're not just saying, okay, I'm going away. You are taking action to deal with this.
Yes. From what I've researched, I believe they are just not in compliance with ADA regulations regarding medical testing of employees. If they were requiring testing of all their employees, they could do that. But because they're taking a subset of employees, just the unvaccinated, and requiring testing, the bar is much higher. They need to have reasonable belief that I could be a danger to the workplace, and they need to prove that with actual evidence, scientific evidence, and current scientific evidence. More than me just proving I have the antibodies and natural immunity and supplying, I think I gave them upwards of 128 different studies that support natural immunity. They haven't done the contrary. I haven't seen any studies that really actually contradict this in a substantial way and prove that vaccines are more effective than natural immunity. Also, which makes matters worse for them, the vaccines have failed substantially during this time period. I mean, they started failing in August when this situation came up. And now, again, according to North Carolina's own data, since late September through now, about a quarter of the cases of COVID active in North Carolina have been fully vaccinated.
So you're taking action ultimately, what do you hope will happen?
Ultimately, I hope they change their policy and make an exception for people with natural immunity. They should not be penalized. There's different ways to arrive at immunity. It's not just vaccination. The conversation should really be immune versus not immune. I absolutely support protecting the people who need to be protected. But when I can prove that I already have protection from COVID, then we should be reasonable about it and there should be an exception made.
Well, we certainly thank you for taking time to tell us your story. Kendall Klett, as we said, worked until very recently with the North Carolina Department of Health and Human Services. And as her story continues, I'm sure that Carolina Journal will update all of our readers and listeners and viewers as to how this story plays out. Thanks so much for taking the time.
Thank you very much for having me.
And we thank you once again for watching on Carolina Journal.